Good afternoon, everyone. My name is Pradeep Goel. I'm the CEO of Solve.Care, and it is my pleasure indeed to be here with you all. Before we get started, I want to commend the organizers of this event. They have done a really good job of coordinating this event, gathering some amazing people, speakers and audience both. So I am truly honored to be here with all of you. My objective today is to introduce to you a fundamental principle that for us to deliver better health outcomes around the world, there is a need for really evaluating how health relationships are defined, managed, administered, regulated, and implemented. And I will share with you our vision for achieving that with the help of blockchain and other technologies, but with the real, true, fundamental objective of improving health outcomes. Because in the end, healthcare is about people, not technology. Regulation is meant to serve the citizen, not to hinder care. And if you really want to focus on better health outcomes for people and for citizens and for nations, then we're going to have to learn to manage healthcare relationships better. And in many ways, the new technology, be it blockchain or AI, can really help drive that improved relationship that we need between doctor-patient and doctor-specialist and patient-payer and patient-government and so on, and most importantly, patient-family. So I'm going to share with you a presentation, which I will need permission from the organizers to do so. And we are going to show you the platform that we have built at Solve.Care to achieve better relationships management. A healthcare platform company that is focused on delivering effective relationship management, and we use blockchain as a technology and many other technologies with the objective of improving health outcomes. And I want to share with you a little bit of my experience. I have spent about 30 years in healthcare, more than 30 years now, from various angles of healthcare, in terms of as an insurance executive, as a government policy implementation executive, as a health IT exec, certainly as an entrepreneur, as a parent, and as a patient. And what I've found, and I've worked in different countries, not just the United States, but have worked with the US, the Chinese government, and also in India. And the commonality that I have found in working across various health systems is that the goals of most health systems are the same. I want to show you here, this is from the Ministry of Health and Government of the Kingdom of Saudi Arabia. The three objectives as they have put forth in their national health policy: improve health, improve healthcare, improve value. We move forward to a vision from the Qatari government, and their vision for their nation is better health, better care, better value. You go to one of my clients, which is Arizona Care Network in Phoenix, Arizona, which is a network of 5,000 plus doctors, improve population health, quality, enhance patient experience, reduce costs, and improve satisfaction. What you find across all of these, and there are thousands such promises and commitments and organizations around the world that are trying to deliver better care, better outcomes at lower cost, or better value. And what we are hearing around the world, and you hear this, I'm sure, if you are in healthcare of any nature, that patients should be at the center of everything. We should have patient-centric healthcare. So patient-centric healthcare is a very common term, used often. And in fact, every population health management initiative, be it a government initiative, be it a regional initiative or an insurance initiative or a clinical organization launching a population health management solution or objective, they always put the patient in the middle. And yet that is not the picture. What really happens is something like this. The patient is external to the data ownership and exchange between insurers, the government, the employer, the physician, the hospital, the third-party administrator. Essentially everybody except the patient is who has the data and is expected to interoperate and share all this information for the patient's benefit. The problem with this picture is that this doesn't lead to effective population health because the patient's choices aren't taken into account and cannot be. And typically the data that is used to determine access to treatment or choice of doctors or who should pay what. And in doing so, the data is often locked up into one of these right-hand side silos or is even lost and is at risk for various misuses. And laws that many governments have passed, Health Information Portability and Accountability Act in the US or GDPR in Europe, they don't go really to the heart of the issue, which is that the patient is not in the center. Now, why is that? The problem with putting the patient in the center is that you have to address 5 key elements. You have to figure out how the data will be shared and how the consent for the data sharing will be given by the patient for these parties, which means that the patient has to be able to view, authorize, permit, and revoke the use of their data. The transactions and payments flow typically around the patient, not through the patient. And that, of course, is a fundamental reason of disintermediation. The access to care and timelines are not determined with the patient in mind. They're determined with cost and utilization and quality in mind, which are good objectives, but ultimately the patient becomes disengaged from that beneficiary and becomes a beneficiary. The identity of patient is not with them. Everybody has their view of the patient's identity, and everyone enforces the patient's rights slightly differently, if at all. So again, and this leads to no trust in the system, and there is no reliability in actual patient adoption and engagement. So my premise for all of you is that population health management is a universal goal, and most nations around the world know that they have to implement population health management to reduce and manage the impact of healthcare on their society, economically and otherwise. But it is devilishly difficult to do. And it is because our models of health IT systems around the world and health delivery systems around the world are set up not in this picture that we aspire to, but something like this. So having spent 3 decades in this equation, more on the right-hand side, and never seeing this picture move to the left-hand side, I decided to take a break from being a government or an insurance executive and build a health relationship platform that would address this economic impact. So you can say, well, healthcare seems to work okay. What's the big deal? What are we solving? The problem is that it's not really working in the economically affordable sense, and value-wise is abysmal. And I won't bore you with the numbers, but you're looking at US numbers, which is 3.8 trillion a year, last published data set, and the 8.8 trillion a year worldwide. About 1.3 trillion is spent on coordinating care, coordinating benefits, and coordinating payments, which means we don't spend 1.3 trillion on the patient. We spend it on everything else, and not on the doctor either. This is spent on IT systems and information sharing and communication management. And that's a huge number. And similar number exists when you combine similar inefficiencies around the world. So this isn't really sustainable. But more importantly, are we delivering better care? No, we're not. So a better approach to this, our premise here, is that patients should be in control. That patient-centric picture starts by giving patient the ability to control and the ability to choose. And our vision here is that the patient should have the access point and the authority point for use of data, for access to care, and the ability to join various care models and care delivery systems, be it clinical or be it administrative, and to do so based on their own specific needs rather than one healthcare model that you have to somehow fit into. And we have built a platform to achieve this vision. And in many ways, I'm the avatar of the client in that I always ask the question, would I have bought this platform if I was still at the insurance organization as a CIO and I was trying to drive better healthcare for my membership? So the idea of this platform and the depth and breadth of this platform is to really handle all elements of healthcare delivery relationship-wise. So in the end, to achieve any kind of a population health management initiative, it's all about coordination. Coordinating care, coordinating benefits, and coordinating payments between all the parties in real time, and to do so with patient truly in the center. And that is the purpose of our platform that we have built using blockchain. And what blockchain does here very simply is to achieve the right balance between privacy and transparency. Patients' rights, identity, their ability to give and take away consents, the events that happen in their life, the transactions that they participate in or facilitate or authorize, payments that are made by them or on behalf of the patient, and who sees the data. These are fundamental questions that on which any and all population health management initiatives rest, be it a governmental initiative or be it a regional or a organizational initiative. And to achieve that, you need a full platform that essentially does what customer relationship management does in business. So our vision is essentially to do what Salesforce.com does for business on blockchain for healthcare. So Salesforce.com meets healthcare meets blockchain is the driving force behind our implementation. Now, what does that mean? What does it actually deliver? What it delivers is complex care delivery networks. What it allows you to do and should allow you to do is to allow for all the participants of any digital health delivery, be it a national program for all the elderly or the poor, or a pregnancy care management system, or diabetes care, or cancer care, or just delivering preemptive teleconsultation services to your entire country. Whatever the digital health network is that the organization or the country or the government is trying to achieve to deliver better care, to achieve better value for the money they spend on healthcare, it all boils down to how do you digitize and facilitate and coordinate all these parties, the insurance company, the hospital systems, the individual and affiliated doctors, the patient and the patient's extended family, transportation networks that get the patient back and forth from the clinic. These are all participants in healthcare. And to deliver that complex and ecosystem in the pre-blockchain, pre-platform universe used to take hundreds of millions and years to implement. And by the time you implemented them, the need had largely disappeared or had changed. So the notion here is that to achieve population health, we really need to make highly configurable and secure digital networks where people can join in various different roles quickly, efficiently, and securely. And their roles can be configured, their relationships can be defined, and that allows immediate transactional and grant and revocation of authority that one needs for care to actually work. So with that in mind, I want to show you how this works in real life in the context of a diabetes care system that we put in place in the United States, where the patient has a downloadable care wallet through which they can create care circle with their family members. They can connect with their provider on this network, and they can also allow for very secure exchange of information in the form of care cards. And the idea being that in this model, I as a patient have absolute control over who is using what information about me or from me, how long they can see it and what they can do with it, and if I want them to be able to share that information in any way, shape, or form. And this balance between privacy and security on a well-defined relationship model, which the network sponsor has ensured is clinically and administratively sound, is what drives true population health management. I can be linking this patient to the doctor, the nurse, the family member, and all of them are defined by what relationships they are allowed to form with the patient. So this is population health management built on a foundation of relationships. And health relationships ultimately are very complex, and our goal is to achieve that health relationship management the same way as you would define them in a CRM system. In the interest of time, I'll move forward and take you to an example of how we have used this platform. So there is a diabetes care platform. Our solution was built in partnership with Boehringer Ingelheim, one of the top pharmaceutical companies, with the idea of facilitating patients' understanding of how to manage diabetes, how to reduce the risk of heart attack, how to prevent death and strokes that are debilitating and life-changing, and how to do so in a manner that the patient can actually effectively use their care wallet as their personal access point to all data and information about themselves. So it extends the data from centralized databases like electronic medical record systems or hospital information management systems or insurance claim systems to actually the wallet and in the palm of the patient. So let me move forward to the next network. The other network that we have built using this platform is called Global Telehealth Exchange, which is a real-time open physician network that allows patients to find and make an appointment with a physician worldwide. And we have launched this network in 20 countries, allowing for both in-country and cross-border consultations. And the objective over time is to permit a truly patient in any country to be able to work with a physician in every country, subject to, of course, regulatory laws and payment laws and clinical laws. But the idea is to ensure patient choice. If we keep talking about patient-centric care, but we keep telling them that they can't go see very many doctors, it's not really much of a patient-centric care. So our vision here is to deliver truly open networks in the world that allow patient-provider choice of the nature that regulators would ultimately permit in the context of better care, better choices, and lower costs for everyone. A third network that we have launched is a transportation network in partnership with Lyft and Uber, where instead of waiting for an expensive transportation in the form of an ambulance and or missing appointments, we have integrated appointment making with automatic ride booking, with automatic payment by a third party, such as family members or insurance company or government agency, meaning that we can link the patient's care needs with their transportation and do so in real time and ensure that we have full understanding of who, what, when, why, and how much was spent on transportation. And this allows for the patient and the patient's family members to dramatically reduce the amount of times when a patient is a no-show or a physician is unable to reschedule the appointment because the patient does not have transportation to get to the appropriate place at the appropriate time. Now, the objective of all of this ultimately boils down to one thing, which is if you're going to implement population health around the world or anywhere successfully, then we're going to have to deal with roles of who plays the role in that population health, what relationships they have with the other members of that population health network, what information is shared by whom, with whom, for what purpose, and who has rights to this information and for how long, and how is the access to care ultimately facilitated through this population health platform. So in our world, the partners who are looking, or clients, if you will, who are looking to implement population health range across a wide spectrum of companies, right? Government, public health agencies, insurance companies, hospital networks, clinical networks of independent physicians, pharmacy networks, pharmaceutical companies, healthcare IT organizations who are trying to innovate and build new and clever new systems, system integrators who are trying to integrate all this silos of data, community initiatives to drive and manage, whether it's a pandemic-driven response or a disaster model, and of course, charitable organizations. These are all entities that in one way, shape, or form are trying to implement population health, and we are working with a whole range of such entities, and we are looking for more to adopt the platform and work on it. But at the end of the day, I want to take us all the way back to the picture, if I may. Excuse me. I will. And this is where we are trying to get back to. We're trying to get back to putting the consumer in the center of any population health management system and ensuring that the patient is the data hub, the information hub, the access hub, and the authority in terms of how their healthcare is being managed around them, for them, and by them. And this being the objective, our submission to you all is that to achieve this, one needs to first start by establishing a framework in which patient has clear relationships with all the parties surrounding them, and those relationships are encapsulated and managed in a manner that we know who is sharing what data with whom, what transactions and payments are occurring between the patient and all its care team around them, how care access and timelines are implemented, and how identity and rights are enforced. And that therein lies the most exciting use case of blockchain that we believe exists in healthcare as the fabric for achieving population health management by implementing well-defined health relationships. I look forward to hearing any questions all of you have, and I will stick around in the lounge to answer any questions you might have. Thank you for listening. I appreciate your time and energy. As a final point, if you wish to speak to Solve.Care, I can info@solve.care is one of our well-known email addresses. We're also very active on Telegram and on many social media. Solve.Care is in many countries, and we are practically operating around the clock in terms of the time differences. So you can always reach out to us, and we'll be more than happy to engage with you. Thanks, everyone. Have a wonderful rest of the session, and I look forward to hearing from all of you.